All right, well, good afternoon. Thanks for being here. My name is Tom Norton, and I am the Chief Medical Officer of Marquette General Health System and Superior Health Partners. And this is truly a historic event today. We have gathered here a group of healthcare leaders who are known for their dedication and for their determination to make an announcement on something that's going to change the shape of healthcare delivery here in the Upper Peninsula. And I'll add on a parenthetical note, I've been a physician here for 3.5 decades, and this is one of the most exciting events that I've seen, and it certainly is one of the most progressive. So I'd like to have the pleasure of introducing our group. Sitting immediately to my right is Tim Larson, who's the chairman of the Superior Health Partners Board of Directors. Pat Pritchard is the director of Upper Peninsula Regional Sales and Operations and West Michigan Regional Initiatives for Blue Cross Blue Shield of Michigan. Jim Bogan is the president and CEO of Portage Health. John Schoen is the president and CEO of the Dickinson County Health System. And Tim Zwicky is the president and CEO of Baraga County Memorial Hospital. About a year ago, Superior Health Partners was formed in order to provide a foundation for the structured alliance of healthcare providers with a common vision and commitment. We had a long-term strategy of bringing greater access to healthcare at high quality while doing it efficiently to reduce costs. And because of the pressures of those leaders, realizing what was coming on the national scene, we now find ourselves well positioned with national healthcare reform. And in fact, Superior Health Partners has already progressed steadily since its inception a year ago toward becoming what's called an accountable care organization, or so-called ACO. Now, ACOs depend upon, rely upon the collaboration, the working together, the synergisms that come with healthcare organizations combining their talents in order to reduce healthcare costs as well as to always increase quality and service to patients. That's the main priority. ACOs depend upon partnerships between hospitals, collaboration and alignment with physicians, the development of an infrastructure of information technology for the facile, rapid exchange of secure information about patients with providers so that we can give best care. But in this time of cost constraint, it's also important to be very cost conscious, and so business principles must be definitely applied in operations expense management. And finally, in modern healthcare, you have got to have a strong relationship with a payer organization in order to do well. There's no question about that. So in the end, an ACO, an effective healthcare delivery system that's successful, can reinvest its resources back into itself for technology, for advancing medical care further, for helping to advance its own healthcare delivery system, and finally, an important feature is the creation of new jobs, both in terms of economic vibrance in a region such as our Upper Peninsula and in the healthcare arena. So by combining resources, by managing what our providers give us care, and by taking on in a proactive fashion healthcare reform, Superior Health Partners has been and will continue to focus on high quality care, enhanced care and service for our patients, and better medical treatment. And again, as somebody who's been here in the Upper Peninsula for 3.5 decades, I will tell you this is something I've learned. The people of the Upper Peninsula with a task at hand generally prefer to be leaders and not followers. And Superior Health Partners, in keeping with that tradition, is stepping forthright proactively into developing this healthcare reform, something transformative really across the peninsula, something special for our population, at the same time creating a model that I think will have national significance. So on that note, I'm very happy to ask Mr. Tim Larson to come up, who again is the chair of the SHP Board of Directors, for some comments. Thank you.
Thank you, Tom, and good afternoon. As chairman of the board of Superior Health Partners, I'm pleased to announce the addition of 4 partners to the SHP Alliance of Caregivers. They include Blue Cross Blue Shield of Michigan, Portage Health of Hancock, Dickinson County Healthcare System of Iron Mountain, and Baraga County Memorial Hospital of Lawrence. By aligning themselves with the mission of Superior Health Partners, these healthcare organizations have made a commitment to strengthen healthcare in the Upper Peninsula in order to benefit patients in their communities. UP residents will see their community healthcare organization remain independent, while the affiliation with SHP will strengthen each hospital's ability to compete with out-of-state healthcare providers, which in recent years have systematically tried to steer specific healthcare services out of the Upper Peninsula. The Blue Cross Blue Shield affiliation with SHP is in direct response to patient migration to other states, most notably Wisconsin, where healthcare costs for many services are significantly higher than the Upper Peninsula. The Superior Health Partners advances its mission to enhance quality healthcare services in the Upper Peninsula and proactively prepare for national healthcare reforms. Affiliates and their customers will be positively impacted by improved access to healthcare services, improved quality outcomes of treatments, and improved patient satisfaction. SHP is focusing on reducing the amount of healthcare dollars leaving the Upper Peninsula because of many of the services sought are provided right here in the Upper Peninsula with solid quality standards and generally at a lower average cost. The affiliates of Superior Health Partners will have a vested interest in working together to keep care in the Upper Peninsula. This alliance will help curb the destructive outmigration pattern, resulting in stabilizing and strengthening the healthcare employment base. As we know, with the state of the economy, jobs are extremely important. On behalf of the Superior Health Partners Board, I'd like to welcome the new SHP Alliance members. The people of the Upper Peninsula will be the beneficiaries of our teamwork. What I'd like to do now is turn it over to the representatives from the newest members of our Superior Health Partners family for their comments on this exciting affiliation, and we'll start by welcoming Pat Pritchard, Blue Cross Blue Shield of Michigan.
Sure, thank you. Very well done by Dr. Norn and Tim. So not, short of being redundant, not a lot more to add to that, but on Blue Cross and Blue Shield standpoint, we currently have a very good relationship with the gentlemen entities that you see before you today. This, I see it as just strengthening that relationship and that partnership and the alliance, if you will, to really just what we're all about, Blue Cross Blue Shield, and our mission is to provide quality, accessible care at a reasonable price. So this affiliation will help us to continue to do that. And as far as the out-of-state migration, currently, as both mentioned, that a lot of care does go out-of-state. We certainly have competent physicians, organizations, hospitals here that can serve the needs of the UP residents. We hope to curb that out-of-state migration by this alliance as well. So thank you. Turn over to Jim, I guess.
Thank you. Speaking on behalf of Portage Health, our opportunity here to join this alliance as an associate is something that we felt was very important. This is the beginning of a journey that has been really grounded in a historical past that relates to a very strong relationship that Portage has had with Marquette General, and for many, many years. The vast majority of our patient referrals out of our community come to Marquette. We see that continuing and strengthening as we go forward, and we have welcomed the opportunity. We've had a lot of dialogue with the Marquette and the Superior Health Partners in terms of where we need to take to the next level. And as I stated at the beginning of this journey, is to prepare ourselves for all the things that national healthcare reform might throw at us. We have been very resilient in the UP in the past to address issues when they come along, an opportunity to be out front, and as stated earlier, to be a leader in the area of healthcare reform. I'd like to also, in closing, make a comment that I thank Marquette General for their vision to form the new Superior Health Partners organization, and I'd also like to thank Blue Cross Blue Shield for their efforts to partner with us as providers. So providers and payers, the leading payer in the state of Michigan, can come together on a regular dialogue and create solutions to problems. Thank you.
John Schoen from Dickinson County Healthcare System. I echo all the comments that have been made today. Been part of Dickinson County Healthcare System since 1985. We've been part of several initiatives through the UP Health Plan, through the UP Healthcare Network. Worked with my colleagues here over the years to try to figure out ways we could enhance UP healthcare, and I think really this alliance allows us to do so. As we know, there's several $1 million leaving the UP in healthcare every year. We've been fortunate as a healthcare system in Iron Mountain. We've been able to double in size over the last, say, 10 to 15 years. We've been able to double our employment, our medical staff, and I truly feel that, that ability to even double again is there. And I think it's a partnership such as this that aligns ourselves with the major payer in Michigan Blue Cross and the tertiary facility in the UP market in general, really allows us to provide that comprehensive care and serve our patients better. And again, it's a partnership with our communities, and I really think that as we try to strengthen that partnership, we need partners ourselves to survive what's coming at us from a national healthcare perspective. So with that, I thank the partnership, and I thank our communities, and I want to turn it over to Tim Zwicky, CEO of Baraga.
Thanks. I am actually new to the region, and what's happening here, I came from a very integrated healthcare system, but there was two things that were missing. One of the things that was missing was an organization that brought together providers that work in the healthcare system. Superior Health, and the other piece that was missing was also the real-time connection with the third-party payer, Blue Cross Blue Shield. And one of the things that I think why I was really interested in becoming a part of this was the fragmentation of healthcare, not only in the region but across the country. And this allows us for referring to specialists to actually share information on a real-time basis to increase the quality of care, which equates to lower cost in providing health care, which I think for the organizations will assist with sustainability. And for the county that I come from, which happens to be the highest unemployment in the state of Michigan, it for me was a protection strategy and job growth.